Respiratory distress. Introduction. Acute respiratory distress syndrome is the sudden failure of the respiratory breathing system. It can develop in anyone over the age of 1 who is critically ill.
Hi everyone, we're back, and today the topic for discussion is the patient in respiratory distress. Here is Jim, a 21-year-old who was transported to the emergency room by paramedics. He was
Causes of ARDS include sepsis is a bacterial infection of the blood, trauma, pneumonia or other lung infection, multiple blood transfusion, breathing in salt water, breathing in harmful smoke or fumes, breathing vomit into the lungs, narcotics, sedatives, overdoses of tricyclic antidepressants, and shock.
So let's go into our progression of ARDS here, okay? So with acute respiratory distress syndrome, we have a few things.
Signs and symptoms of ARDS may include feeling like you can get enough air into your lungs, rapid breathing, low oxygen levels in the blood, cough and fever, low blood pressure, confusion, and extreme tiredness.
This is Andrew Wolf, and I am going to make a short video about acute respiratory distress syndrome, otherwise known as ARDS. Now, acute respiratory distress syndrome is
Diagnosis. Medical tests for ARDS include an arterial blood gas test in which checks the oxygen level in your blood, chest X-ray which can show extra fluid in your lungs, other blood tests that can find an infection that may be causing ARDS, CT scan which can show problems in the lungs, heart test to look for signs of heart failure. This can cause fluid build-up in the lungs. Thank you.